Hey there, this is Dr. Paul Firnhaber at Lincoln Disc and Nutrition here in Lincoln, Nebraska. It's time today for 10 minutes of truth because it's Wednesday. Okay, I've got another great article that I want to go over with you that I think is really important. This article came out at the beginning of this month in June. It's from the New England Journal of Medicine, which, as I've talked about before, is one of the top 4 medical journals in the world. And it's one of the most authoritative journals that's out there. And the name of this article is Structured Exercise After Adjuvant Chemotherapy for Colon Cancer. So essentially what they did, and I'll get into the details more in just a minute, is they looked at people that had stage 3 colon cancer, that had gone through chemotherapy, and they put them on an exercise regimen, and they wanted to find out if this would extend their life and extend their health. So, very interesting study. So let's delve into some of the aspects of the study. First of all, this article starts out, says colorectal cancer is the 3rd most common cancer and the 2nd leading cause of cancer-related death worldwide. So that's a pretty interesting statement in and of itself. And as you know, I do a lot of talk on nutrition. And colorectal cancer, to be quite honest, is very much related to what we eat. Standard management for stage 3 or high-risk stage 2 colon cancer includes surgery, followed by 3 to 6 months of chemotherapy. Despite these treatments, recurrent disease develops in 20 to 40% of the patients. So let's just split that in the middle, 30%. So about 1/3 of the patients have recurrent colon cancer after surgery and chemotherapy, which is, I think, a fair amount. Moreover, surgery and adjuvant chemotherapy for colon cancer cause side effects that undermine the quality of life and reduce physical functioning. Well, if that isn't the biggest understatement I've ever seen. Interventions that improve both survival and quality of life in this population are needed. Preclinical studies have shown that exercise can reduce the growth of cancer, including colon cancer. Now, that's a very powerful statement right there. And you know what? I bet a lot of people have never heard that before. In addition, observational studies have shown that patients with colorectal cancer who perform an increased amount of recreational physical activity after treatment have a lower risk of cancer recurrence and death, including those with stage 3 colon cancer. So this study was a randomized controlled trial comparing the effects of health They grouped this into 2 patients. One group of patients, and there's about 450 patients in each group. One they gave health education materials to. They said, read this and follow this. The other one had structured physical exercise for 3 years. In other words, they kept close track of it. Patients in the health education group received general health education materials promoting physical activity and healthy nutrition in addition to standard surveillance. Those in the exercise group received the same materials plus an exercise guidebook developed for colon cancer survivors and support from a certified physical activity consultant for 3 years. The support program was guided by the theory of planned behavior and consisted of evidence-based techniques for behavioral change delivered over 3 phases. So I won't go into the weeds on how they did that, but there is an interesting statement in here. The focus was on promoting aerobic exercise of at least moderate intensity, such as brisk walking. Now, however, patients could choose a type, frequency, intensity, and duration of aerobic exercise. So that's very interesting. So I don't consider brisk walking to be an intense exercise at all. I think it's very moderate. I'd say light to moderate. But in this situation, that's all they would have had to do. Now, disease-free survival, the primary endpoint, was assessed in the intention to treat population and was defined as the time from randomized to the first event that was either recurrent colon cancer, a new primary colorectal cancer, a second primary cancer, or death from any cause. Overall survival was defined as from the time randomization, which was when the study started, to death from any cause. Now here's the results. Here we go. Exercise significantly reduced the relative risk of disease recurrence, new primary cancer, or death by 28%. The disease-free survival curves began to separate at about 1 year, which means that you had to do regular exercise for at least a year, and continued to separate over a 10-year follow-up with an absolute gap or absolute between group difference of 6.4 percentage points at 5 years. Moreover, exercise reduced the relative risk of death by 37%. So at 5 years, that's when you got at least the biggest gap, okay, 5 years and beyond. Now, it said the absolute difference between the group was 6.4%. Now, that doesn't seem like a lot, and absolute is actually more important than relative, because absolute says, really, how many people did it help? So let me put this into perspective for you. When you look at the statin trials, the trials with Lipitor, Mevacor, the statin trials, and they look at how many people, absolute people, did it save over a 5-year period. The absolute values is 1%, one individual over 5 years. So this is 640% greater than the Lipitor trial, okay? So with Lipitor, the absolute value is, it prevented 1 heart attack or 1 death. This is 6.4%. So compared to that, this is really good. So basically, this study says the magnitude of benefit from exercise delivered after surgery and chemotherapy was similar to that of many currently approved standard drug treatments. Boy, what a sentence that is. So they're saying that this is at least as good as a lot of pharmaceuticals could do, just exercise. So the moral of this study is this: exercise will prevent the recurrence of cancer, and it can prevent the recurrence of death from cancer, and pretty advanced cancer. So think about this. If you don't have cancer and you're exercising, maybe you're preventing it in the first place. So this is a huge study that really promotes exercise as being at least as powerful as the best drug out there to prevent the recurrence of colon cancer or the occurrence of death from colon cancer. And that is very significant. So I would encourage all of you out there listening to the sound of my voice to at least do brisk walking on a daily basis. At least do brisk walking, okay? That, and especially if you've had cancer, that's something that might really keep it from coming back. So this is another great study. Again, this is from the New England Journal of Medicine. I hope that all of you will, if you're not on an exercise program already, but at least consider an exercise program, because it shows how powerful exercise is for our health. So with that, this is Dr. Paul Firnhaber in Lincoln, Nebraska. If you have any questions about your health, about functional medicine or chiropractic, you can get a hold of us at 402-488-2220. Give us a call, and I'll see you next week for another edition of 10 Minutes of Truth.